My name is Morgan Goldsmith, and I'm a registered nurse as well as the Director of Clinical Services for Hospi Corporation. Today, I'm honored to be visiting Ohio's Hospice in Dayton, Ohio. We have the incredible opportunity to speak with members from the clinical team that implemented the MACI catheter in late 2017. They're opening their doors and sharing their time so other caregivers can learn from their experiences in hopes of positively impacting an even bigger group of patients. Please join me as we discuss their reasons for adoption, best practices and implementation, clinical impact, and ask for their advice.
For nearly 4 decades, Ohio's Hospice has served the needs of local communities by providing the very best end-of-life care, support, and comfort to any patient or family who needs their services. A leader and innovator in the industry, they promise to celebrate the lives of those they serve by emphasizing compassion, dignity, privacy, and respect when it matters most.
I think hospice's approach to providing quality care and high patient outcomes is service and education. And the service aspect, I believe that everybody that we work with here really goes out of their way to serve not only the patient, but the patient's family. I think we all take great pleasure in providing every detail that could just make possibly this person's very last moment enjoyable or pleasurable for them. And then education is huge. People don't understand what we do. People don't understand what's going to happen. People don't understand how a person dies. And when you see that moment where there's just an opening, where a person, the family member of the patient, you just see them open and they are ready to take a bit of information. And if you catch that moment, you can provide a lot of information that alleviates their anxiety and provides a lot of emotional and spiritual comfort. And you just have to be open for that, to look for that specific moment when they open and they're ready.
Healthcare has teetered on the brink of a nationwide shortage of injectable opioids for years. In late 2017, Hurricane Maria became the tipping point when it dealt the death blow to Puerto Rican factories such as Baxter and Pfizer. The problem, compounded by limited competition and the lack of redundant manufacturing capacity, has caused many pharmacists to race for alternative solutions.
So the shortage I was notified of right when I stepped into the role of Vice President of Ohio's Hospice. And it was scary. The pattern of practice that we had was no longer sustainable. And we needed to restructure our organization, and it needed to happen very quickly. I had heard about the MACI catheter in August, but it was really just kind of a side conversation. And at that time, then come October, that side conversation became really the crux of what we were able to implement to be able to change the face of providing care at Ohio's Hospice. We implemented MACI catheters, and we implemented them very quickly. So the options were requested that oral and MACI per rectal route were always on the chart, as well as IV and subcutaneous if needed. And then a lot of education happened with the nurses because they're really the ones who are at the bedside making the decision for this patient at this time in this need, what's our option and what's our best option. And so for probably 2 weeks on a daily basis, I looked at charts and just made sure that every patient had oral and rectal routes of medications available in addition to the IV and sub-Q routes. So a little bit of education from the physician perspective, but there was really no kickback on that perspective. Definitely the bigger challenge was with the nurses who were used to practicing in a certain way, and we were revolutionizing that perspective. But in the education that came from our education department, but also, from me being on the floor and coming in on the weekends and coming in on night shift and talking with the staff and explaining, like, this is what we have. We have 4 days of IV morphine. 4 days of IV morphine. What are you going to do 5 days from now? Because we need to have a plan. And once the nurses understood what the crisis was, there was very little kickback. But even the nurses that were the holdouts, I talked with one nurse this week just preparing for this conversation and said, hey, like, tell me what your thoughts are. She says, I wanted to hate it. I didn't want to like it, and I love it. And I mean, the nurses are on board. And when a patient can't tolerate a MACI, it's almost like oh, that's really sad. Like, for them, it's really sad because we can get them comfortable, we can keep them comfortable easier, longer, with less aggressive, less adjustment, less acceleration, and it works. It works.
In hospice and palliative care, patients often need medications to control symptoms such as pain, nausea, vomiting, seizures, shortness of breath, agitation, and fever. Sometimes patients are not able to take these medications by mouth or intravenously. Patented and FDA cleared, the MACI catheter was designed to facilitate discreet and painless rectal administration of fluids and medications.
One of the big things that we've been facing recently are the national drug shortages, especially of all the injectable opioids. So when we were faced with that challenge, one of the routes that came up was using the rectal route. And of course, anytime you talk about the rectal route, there's an understandably reluctance to want to use it. It's an invasion of privacy. Any medication that's given the rectal route has to be done so repeatedly, so it's a repeated invasion of privacy. Suppositories are not comfortable to give. They can cause trauma, and they have to be given correctly. If they're not given a certain way, then you can't guarantee absorption. So those were our immediate thoughts. When we first heard about the MACI catheter, our mind jumped to our past experiences with the rectal route. So that's what first came up. And because of that, we're a little leery. Because of the national shortage, we didn't have many options, so that's when we really started to investigate the MACI catheter more thoroughly. And at which point, like, our injectable usage, we were not going to be able to sustain that. That's when we brought the MACI catheter folks in and learned about it and gave it a shot. And from there, it's been amazing. We've been noticing that we have to do less opioid rotation, and there's less of a titration of the dose. So we've been able to meet all 3 of our goals, the kindness, comfort, and compassion, with the MACI catheter. And actually at this point, our injectable use was high. Now we've slashed it almost 80%. It's amazing, yeah, 80%. And I don't see us, even once the shortage is relieved, I don't see us going back to using the injectables like we had been doing.
The MACI catheter offers a comfortable and discreet way to administer medications while still maintaining the dignity of the patient by allowing medications to be given without repositioning the patient or repeatedly invading the patient's privacy.
The MACI catheter has had a huge impact at Ohio's Hospice. Our patients now have a route that they can get their medications through that doesn't involve having IV sticks and multiple sticks. At end of life, patients don't have good veins, and it's always a challenge to get an IV in them. Now we have the MACI catheter. We can teach families. They can take their loved ones home and use the MACI catheter. Before, we would train them on IV push medications, and it's not easy and it's scary. This makes it easier for them, for families and loved ones. For nurses, it's amazing because we now don't have to wait for somebody to come and waste. We are not wasting as many narcotics as we used to. The push is a quicker push, so they're pushing the medications a little bit quicker, or a lot quicker compared to IV, and now they have more time to spend at the patient's bedside giving compassionate care.
Introducing a new way of administering medication isn't without its challenges.
So the hospice clinician has a toolbox full of lots of different items that we use, lots of alternative medicine things. We use music, we use aromatherapy, we use massage therapy, all kinds of things. And the MACI catheter can be in that toolbox in a way that we're not sticking patients and starting IVs or giving frequent sub-Q injections. We now have a tool that we can pull out, we can insert, we can give medications without having to stick people. Families and patients don't like needles. And this is not a needle, and it's very comfortable. I haven't had any patient that seemed like it's disturbed them at all. Most of the time they don't seem to even notice that we've put it in. So that's nice. And to have the family stay in when you put it in so they understand that it's not trauma. Definitely showing the family the catheter before you insert it is a good tool so they can feel it and touch it and know what it's like. And then once families understand and see the relief that their loved one gets without the needle sticks, patients' families don't like needles, so this is a good alternative.
Honestly, I was a little awkward with it because it is a little awkward putting a catheter in someone's rectum to provide medication. That it was a new thing, and you know, when you mention it the first time to a family member, you can see that they are not on board with it. So I've had to kind of readjust my approach and my delivery, and because I realized that my face said awkward. I would say, we're going to put this catheter in the backside, you know, and my face would crinkle up a little bit, and I realized it's like, you know, I have to be conscious of what I'm delivering here. So if I come in confident and I say, we've got this great new catheter that provides medication. Now, it does go in the rectum, and that's a little different, but it's very beneficial. And then I have read the information about the mechanics of it. It makes sense to the families, and they think, well, maybe that's not such a bad idea after all.
You know, at the beginning, the nurses were very, very reluctant to use the MACI catheter because we couldn't understand how a rectal catheter would be comfortable for patients at end of life. And many of us are pretty intense on advocating for our patients, and that was just didn't seem right. We implemented it, the doctors presented research, education came in and kind of educated us on how to use it, and we started using it about a month into the process. We were really shocked. I couldn't believe the outcome. People who were very terminally agitated, who we were having trouble with controlling their symptoms with by mouth medications, they were responding. It was just amazing. So I explained, you know, that this is something that we're all against, and we've seen phenomenal results. Most of the time, they're very accepting of it, and they're also in agreement that this is helping their loved one. It's really proven to be very effective for pain.
Because Ohio Hospice consists of not-for-profit, community-based hospices, their first commitment is to meet the needs of patients and their families. They are leaders in the end-of-life, palliative, and bereavement care, and industry pioneers in healthcare education for clinical professionals.
We introduced and trained clinicians here at Ohio's Hospice very quickly. After the meeting and the powwow of sorts that we had with the MACI catheter people, and we got the supplies so quickly, we utilized the tools that they gave us, that the MACI catheter company gave us, that I put in the Relias Educational Learning System. Nurses had just a few days to complete that. That included a video and a brief test and just the step-by-step instructions. So that was real helpful, and people really used that. Nurses usually don't like change, but Dr. Schmitz had sent out a letter that explained the crisis, and we understood that there was a crisis, so people were more apt to just jump on board and knew we had to change how we were doing things.
I didn't see that there was any possible way that another route of medication administration could be any better than what we were currently providing. Mainly, specifically, a very narcotic parenteral medication heavy process. We function on the level of a hospital here. And I didn't realize there was something better than what we were already using. This is a whole new level of practice, and I will never go back to the practice that I had before. And I just cannot emphasize enough. I can get people comfortable. I can keep people comfortable. I'm not accelerating medicine. I'm not adding medicine. You get the MACI in, you give them medicine, they're comfortable, and that's it. You know, it's not this aggressive acceleration with side effects, and people are just comfortable. Less cost, less waste, not having to poke them, not having to maintain a peripheral IV, not having to use subcutaneous injections. You put in the MACI, you have excellent absorption, you have excellent patient comfort, and people pass away very comfortably wherever they want to pass away.
From patients to caregivers to clinicians, everyone has a story to tell.
Well, the first time I used the MACI catheter here at Hospice House was with a patient who came in with pancreatitis, and they had come straight from the hospital. And in the hospital, it's loud, there's alarms, there's noise, there's anxiety, there's vital signs, there's interventions, there's procedures. Everybody comes from the hospital high-strung. And agitated, uncomfortable. So this poor little lady came in, pancreatitis, she couldn't swallow, she had incredible nausea, her belly was distended, and the family was distraught and wringing their hands. And I said, hey, we've got this MACI catheter that's beneficial. I offered the MACI catheter, we put one in, and within like 15 minutes, the whole room relaxed because the patient relaxed. I mean, when I went back in to check to see how people were doing, it was like a whole new family, a whole new patient. It's just everything had calmed down. And once that happens, the family then can kind of relax into the experience, you know, because we've got a great facility here. We've got great rooms. We've got lots to do. They can look out the window. You know, you see them look out the window and say, oh, well, isn't that beautiful? And then the patient can look out the window and say, isn't that beautiful? Because there's not that angst and that tension and that anxiety, because they're comfortable and there is no needles.
The first time I used the MACI catheter was with an orientee. She'd had her classroom training on how to use it, but we were at the bedside now with the patient. When we went in the room, I actually knew the family. I'd worked with the daughter at my previous job years and years ago, and we remembered each other and talked, and she trusted me. So then I asked her if she wanted to stay because she was very protective of her mom, but she opted to step out. As soon as she stepped out, it's so quick to insert. We had it in, and she couldn't believe we were bringing her back in so quickly. We gave medications, and her mom was comfortable so quickly after that we sold her, and she agreed to let it stay in. I always tell families that if it bothers the patient, we can always take it out. And in my experience, that hasn't happened. They see the good effects of it, and then they're okay with leaving it in. This is a catheter I would use with my own family. I would put this in my mom without a second thought.
Thank you for joining us as we learned about Ohio's hospice experience with the MACI catheter.